Hi everyone, I'm Snigdha Manchanda, founder of T-Chunk, and every year in September for PCOS Awareness Month, we partner with various specialists to answer some of your most pertinent questions about PCOS. I think in the last 2 years since we've been doing this, we've seen a lot more awareness. And I think even women who probably are not diagnosed with PCOS are more aware about the risk assessment for it. So over the last 2 days, we opened questions to all of you to send in to our healthcare expert. And for today's session, we partnered with Veera Health, who specialize in PCOS. And we have an expert nutritionist, Tanvi Kulkarni, joining me shortly. And let me just quickly send an invite for Tanvi so we can have her join us. So for those of you who had a chance to send in your question over the last 2 days, we'll be answering them today, and I've made a note of all of that. And I have Tanvi with me. Hi Tanvi, how are you doing?
Hi, I'm good. How are you doing?
Thanks so much for joining us, Tanvi.
No
And
problem.
I was just sharing that every year at T-Trunk, we've been doing this awareness campaign in September. And just since the last 2 years, since we've been doing it, we've seen a lot more engagement, a lot more questions about it. So I have a list of questions for you to get started. But for everyone who's joining us, welcome. And we're just getting started. I'd like to introduce Tanvi, who's from Veera Health. And Tanvi is done her master's in nutrition and she specializes in weight management. And her happy pill is, of course, dancing. You did your BA in Bharatnatyam. That's right.
Yeah.
Wow.
Yeah.
That, that's very interesting, Tanvi. And as a PCOS expert, Tanvi believes in a very holistic approach and not a symptom based treatment. And we'd love to know more about that, Tanvi. So let's get started. I have a list of questions here. And number one is
Yeah.
for women who already know that there is a family history of PCOS,
Mm-hmm.
what are some of the symptoms that they should look out for? I think, many of them have these questions about, I don't know if I have PCOS, but I know my mom has it or my aunt has it. So what is a good starting point for women who have family history of PCOS?
Right. So, definitely PCOS could be genetic as well. So, if your, mom or sister, anybody has it, then there are chances of, having it because it's in the genes, right? So, some of the signs to look out for, would be irregular periods. If, you've missed your periods, for more than 35 days or getting your periods less than 21 days, then that is one of the, signs that you could look for. And then, if you have, say, hirsutism, basically, facial hair, on your chin, or, excessive hair growth is there, then definitely that could be one of the, signs to look out for. Again, if you have hair loss, or, there is, basically, the scalp, if you're losing more hair. So, definitely that could also be one of the signs to look out for. And then other, symptoms associated with PCOS are, low energy levels, you've got mood swings because of the hormonal imbalances, right? So definitely looking out for those signs, and, then managing those with the lifestyle modification is very, very important. And then even if it's in your genes, right, you will be still able to manage that, right? You can prolong it, definitely, right? So looking out for these signs, and then with the lifestyle modification, managing it is going to be very, very important so that you're prolonging it, right? So that is something that you should look out for.
I think that's a good starting point. So Tanvi, when I, just do Google search on I'm losing weight, do I have PCOS? Or I'm gaining weight, do I have PCOS? And actually, in both the scenarios, you get a similar kind of search result saying that, oh, you may have. So I want to kind of understand, is it a myth that, you know, if you have PCOS, you will always put on weight or you will always lose weight? Which one is true?
So I would say that, it's definitely a myth, because even when, women who, are, overweight, or, who've gained weight, may not have irregular periods, right? So just, you seeing changes in your weight would not be a sign of you having PCOS, right? So basically, as I said, that, we would want to focus on the most important diagnostic criteria, which is if you're having irregular periods or no periods, or, you have elevated testosterone levels, right? So and that will, you will understand if you've done your blood work, or if you have excessive hair, facial growth, or acne, right? So that could be one of the criterias. And then also, if you have polycystic ovaries, where there are 20 follicles on one or both the ovaries. So these would be the diagnostic criteria to, understand if you have PCOS or not. So just losing weight or gaining weight is not a sign, definitely, because of the hormonal imbalances and insulin resistance, where your body is producing insulin but not being able to utilize it. So basically, it's the metabolic, disorder, right? So where your metabolism is affected. So because of that, you would, see that unexplained weight gain, but just you are gaining weight or you're losing weight would not be, a sign of you having PCOS, because there are a number of other factors that needs to be considered.
Got it. And you spoke about getting your hormones tested, like blood work. So, women
Yeah.
after what age should get their hormones tested, and how often should their hormones tested?
So again, if you have, when it comes to PCOS, right, it may not be a fixed age, right? So for example, if a woman, has hit her menarche, from that day only she might get irregular periods,
What,
right? So just
Tanvi, what was the term that you just said? If a woman has?
menarche. Menarche. Hit your menarche when you get your periods,
Okay.
right? So that is the age when, you would hit your, that's the age when you get your periods, right? So that is somewhere between like 13 to 14 years of, or it depends person to person, right? So if you've got your periods irregular from that time itself, then definitely, that understanding that, okay, I'm getting my irregular periods from the start. So just doing those blood works, would help in just understanding, what exactly is the progress, or, what is the hormonal, is there any elevated hormones, or is there any, imbalances. To understand that, definitely, you could get it done. But still, after, like, probably after age of 18 or 19, you could just, do the blood works, because, initially, at age of 13, 14, we may not really understand, what is happening, because now we are creating the awareness that these are the signs and symptoms that we would want to look for, right? But initially, we may not really get it. We feel that, okay, you've started it, so you might, get it, you would regularize it. But just maybe starting from 18 or 19 years, would also be good to just understand what is the, is there any elevation in your hormones. And most importantly, when you do those tests and you understand that, okay, there has been some elevations, or there is, some deranged levels, then repeating it maybe after 6 months or 1 year would always be regular. So we at Veera try to do it after every 3 months, just to see, how the progression is, right? Because this is, as I said, it's one of the criteria to understand if there are any elevated blood hormones, so it's important that we try to understand that and do regular checkups, so that we know everything is under control. Because at the end, PCOS is all about management, right? You cannot completely cure it, but you can only manage it. It's like diabetes and hypertension. Even if you're taking medication, and then even if you're taking medication just to kind of, bring down your insulin levels, or, some other underlying condition, we still need to continue with the lifestyle management, because that's all about, how you will be able to see those symptoms, or, regulate your periods or improve your symptoms, right? So it's a long term journey, definitely. We have to give the time it requires, but it's all about management. You have to manage it, because it cannot be completely cured.
So here's a reminder to all the women who've joined us. Please check, when did you get your hormones tested the last time? And if you haven't, here's a good reminder to just have that information readily available for you. It may or may not be out of sync, but just good to have a record so that you can track it in future. right?
Right.
So, I mean, the next question that has come up, of course, is about the diet. I'm just reading it out here. So, especially like superfoods, everybody is talking about what superfoods should be included in a PCOS diet plan. And, I know from my experience to speaking with nutritionists, so there are two ends of the spectrum, right? One is to not make significant dietary changes and, just work on like portion control and lifestyle and exercise. And the other end of the spectrum is to completely change to a diet plan to even turning vegan and, including superfoods. So I
Yeah.
think all of us as women, we keep hearing two ends of the spectrum, and I'd like to hear your
True.
take as a nutritionist. Where does the balance lie?
Yeah, so it's a very interesting question actually, because nowadays we are just like, reading so much about avoid this, or include this, or do seed cycling, etc., etc., etc. Right? There's a lot of coming up. So as a nutritionist, my take would be here that when it comes to PCOS, balanced diet is important. It's just how your body will need all the required nutrients. So zinc, magnesium, vitamins, proteins, probiotics, omega-3 fatty acids. So all these nutrients are very, very important for your body to function properly, right? So we want to include a balanced meal. We want to include all the food groups in the diet so that we're getting the nutrition it requires. Now, when it comes to being a vegan, or when it comes to avoiding certain foods, right? So, what I would, or what I usually tell my patients is that in case if you're feeling bloating, or if you're having issues with having a particular food, then avoiding it's absolutely fine. But if you know that if you're having a little quantity of milk, say 150 ml of milk, if you're having every day, and if you're okay with it, and then what type of milk you're including, it's organic or it's A2 cow's milk, if you're including that, definitely it's absolutely okay to include that, right? Because it's not necessary to always avoid dairy, or it's always avoid gluten, uh, especially when it comes to probiotics, because curd and buttermilk are really, really important for our body's functioning, right? I mean, if you want to improve your good gut health, we would want to include probiotics in the diet. So definitely we do recommend having curd, buttermilk in the diet. So we don't encourage eliminating anything unless a person is not able to digest it, right? If there's some underlying condition, if it's gluten sensitivity or it's lactose intolerance, then avoiding it is absolutely okay. I mean, it's required because your body would not take it. But if you're able to still digest those particular food, you could always include that, even when it comes to wheat, right? Mixing it with certain foods. So for example, if you want to have, say, a wheat roti, so just add maybe some oats flour to it, or ragi flour to it, make a multigrain roti out of it and have that. So you're also additionally adding more cereals to it, and trying to improve the quality of the meal as well. So just working on, or trying to improving the balance diet in the your regular routine is very, very important. We want to have more balanced meals, and we just don't want to eliminate unless it is required. So that's what we do, right? We want to have all the food groups because we need all the nutrients, and that's how you're going to see improvement in your symptoms. We want to reduce inflammation, we want to regulate the hormones, so we would need all the nuts, seeds in the diet, fruits, vegetables. So we want to include more food groups in the diet so that we're able to see those changes.
I think many of us in the audience would be happy to hear that because, many PCOS diet plans are very exclusive or extreme. I think what you spoke about is to take away the focus from superfoods and rather focus on vitamins and nutrients and minerals. I think if
Yes.
we use that filter, then it may be different food groups or a combination of those. So I think that's a fairly balanced approach for us to work with. And
Yes.
I mean, I see three questions actually about protein powder or like having
Yeah.
protein supplement. Although I hadn't put that in my list, but I think it's a great question since we're talking about superfoods. I'd like to know, Tanvi, how important it is to have an additional protein supplement, either as a powder or something else. What is your take on it?
Right. So again, as I said, that we want to focus on improving the quality of the meal, and we want to have more balanced diet. So we would want to include more proteins in the diet as well, because proteins are not just going to help you with you're improving your immunity, but most importantly, it also helps for the muscular strength. And building muscular strength is very, very important, because that is going to help you synthesize better hormones, right? Because we are working on regulating the hormones. So in when we work around the diet plan, right, we do want to try and add proteins in all the meals. Again, if you're not able to complete your protein requirement, which definitely we calculate based on patient's height, weight, his and her energy levels, or her physical activity. So that aspect is considered, and accordingly when we calculate the protein requirement, um, again considering the bioavailability, whatever you're eating should be digested well as well, right? So when we're including that, if the patient feels that she's not been able to include a good amount of proteins in the diet due to reasons like availability, or busy schedule or something, then additionally adding a scoop of whey protein, or adding some plant based protein is absolutely okay. But that should be considered only when your nutritionist is going to approve that, right? Because we still can include a lot of different foods, food sources, protein sources in the diet. So you could have paneer, you could have whole grain cereals. If you're not non-vegetarian, you could include chicken, you could include eggs in the diet. Fish is again a very good source of omega-3, so including that. So if you're including these foods in the diet, and then if you're able to complete your protein requirement, then you really don't need to rely on some additional source. But in case if you're not able to, then adding would be okay, but that should also be consulted with a proper nutritionist, and then only including it in the meals.
Yes, so for everyone listening in, I think it's a good idea to get a number on what is your daily protein intake requirement, and then plan and decide if you need to take any additional protein supplement. I
Right.
think that's a good answer, Tanvi. Thanks. I think we're getting even right now getting quite a few questions about excessive facial hair growth and how do you control it. I mean, I think apart from the aesthetic value of it, it's also kind of disruptive, so as a lifestyle. So what do you think would really help, or are there any signs you could find or look for to know when this starts happening to you?
So as I said, especially in this part of your, hair, or especially chin, right?
Mhm.
This is like very prominent that you would see excessive hair growth, right? So if you're seeing that, definitely, and then along with that, so it is one of the signs, right? Hirsutism is one of the signs. Again, for every individual, the symptoms are different, right? So some may not have hirsutism but still have irregular periods. Some may have hirsutism, acne, but have their periods regularized, right? So everybody would have different symptoms. So when it comes to hirsutism, which is one of the signs of PCOS, again, checking for this part, or the entire body at times, there is a lot of hair growth. When it comes to that, again, it could be because of the elevated testosterone levels, which is again one of the diagnostic criteria, as I mentioned, that if there is elevated testosterone levels, which you would do it with the blood test, that would help you understand, or the signs that we spoke about, or even the excess acne, that could also be one of the signs, right, that your testosterones are elevated, right?
Yeah.
So
The question actually is more specific that, when you start seeing facial hair, should we be working with a nutritionist and a PCOS expert, or should we be going to, let's say, a dermat and working with, I don't know, someone has asked about, will laser be helpful? So who should you go to when that happens?
So when it comes to that, definitely, taking a, dermat opinion is always good, because, she will be able to guide you. The laser treatment becomes like more cosmetic part of it, but we know the root cause of it, right? And that needs to be addressed only when you are regulating your hormones. So, again, focusing on the lifestyle modification, because we want to regulate the hormones, we want to reduce the inflammation. So as I said, adding more of probiotics in the diet, adding, more of anti-inflammatory foods in the diet, having more balanced balanced meals, getting into the exercise routine, stress management, improving your sleep cycle. So working on a lifestyle, management approach is important, and that's how you will be able to. Now, it won't completely go away, but definitely you would see changes where the hair growth that is coming would have reduced, right? Because unless and until I mean, when it comes to laser, it's all about the cosmetic part of it. So going for that is absolutely okay, but then also understanding the root cause of it, working on it, and then giving the time it requires, because you cannot see it overnight, but at least spending 12 to 15 months, and then you will see those changes. Because when it comes to skin and hair, it really takes a lot of time, and then we know the root cause, so we want to work on that. So when it comes to that lifestyle modification and giving the time it requires, so that you would see reduction in that. It won't completely go away, but there will be reduction after a period of time.
Okay, great. So I think to summarize, I think it's good to get a dermat's opinion just from a skin perspective, but it will not go away unless and until you treat the root cause. And that is where you need to work with a PCOS expert
Expert.
who has a holistic approach. So
Yes.
I think what you're doing at Veera, where it's not just only skin or only hormones or only periods, it's a more balanced approach to making a
Yes.
life. I think that's very important, Tanvi. And Tanvi, I'll take the last question, which is of course about irregular periods. So, is it possible for someone who's diagnosed with PCOS to finally have normal periods, to have regular periods? Is that possible, or is it that if you're diagnosed with PCOS, you're going to continue having irregular periods?
Right.
Again,
No, no, not at all.
myth around it, so it'd be good to
Yeah.
know.
Yes, definitely. It is possible that you regularize your period. Even as per the doctors, right? Even if you have PCOS, if you're getting 8 to 9 or 10 cycles per year, it's absolutely normal for uterus to shed it, right? So you may not get like 12 cycles per year, but still, if you're getting somewhere between 8 to 10 cycles, it's absolutely normal. At the end, we want the uterus lining to be healthy, and it's just shredded out, right? So definitely it is possible. My patients have seen tremendous changes with the lifestyle modifications, with the diet they have got, with even again, we do work on patient to patient, where it depends on symptoms. But even if a person is has gained weight with 5 to 10% of the weight loss with the dietary changes, the periods have regularized. And same with, if a person is a lean PCOS, still, with the lifestyle changes, with, certain alterations in the diet, have, and then, exercise routine and stress management again, because when your cortisol levels increase, right, definitely your body goes in fight and flight mode, and it really disrupts your hormonal, function. So, with the lifestyle change that we're doing, definitely patients have seen improvement in your periods. They have got their periods regularly, and it is possible, right? So it's not a myth. You can get your periods regular. You can have normal periods. You just have to manage it, and that's how it's all going to work.
I think that's really helpful, Tanvi. And I know I said last question, but I think you mentioned about exercise. So we've spoken about skin, we've spoken about hormones, we spoke about diet plan, and I think the only missing piece in the puzzle is exercise. And again, there are a lot of myths about that. Oh, you must only do yoga and that is beneficial for PCOS. Or you must only do strength training and build muscle and that will help you. So there are so many, there's so much information about this. So is there like one exercise routine will that help you with PCOS, or is it a combination? I'd like you to clarify that too.
So, it's going to be a combination, right? Because every form of exercise has its own benefits. For example, if you're into cardio, right, it's going to help you, burn more fat, or it's just going to, challenge your heart rate, and that's going to improve your stamina and endurance, which is very important, because when it comes to PCOS, your energy levels really, are low because of the hormonal imbalances, right? So when you're, into the cardio exercises, definitely it's going to help you, improve your endurance, and that's also going to improve your energy levels. So when it comes to cardio, we can include different exercises, not very high intensity, but certain cardio exercises, just going for a brisk walk or maybe cycling or swimming could also help a lot. Now, along with the cardio, doing some strength training is equally important because we want to build, as I said, that muscular strength is very important. So when you're doing strength training, you're building your muscles. There is a lot of breakdown of the muscles, right? So
Right.
that's going to help you build those muscles, right? And when you're doing that, it is going to help you synthesize, your hormones. It's going to regulate your hormones, or it's the so basically brain is going to produce better hormones because you're more muscular, because you have more muscles, right? Again, muscles are active tissues, so when you're going to use a lot of energy, so again it's going to boost your metabolism, right? So a combination of cardio and a combination of strength training along with yoga, so that, because when it comes to PCOS, there's a lot of stress, anxiety, they I mean women do face lot of mental health issues because there's so much to take, right? PCOS is had it's a hard journey at times, right? Because you do so many things and it's sometimes very, very overwhelming, right? So again, pairing it up with some yoga, we're doing some asanas, you're doing some meditation, so that you're calming yourself down, and you're just relaxing yourself and you're feeling better. So a combination of yoga, cardio, and strength training is what you would be an ideal way to deal with PCOS, because you're building your strength, you're building your endurance, you're improving your energy levels, you're reducing your stress, you're more calm, you're more composed, which is going to help you improve your mental health, right? So when you're working on so we want to work on the physical, emotional, and mental health aspect when it comes to PCOS, because at times it's an overwhelming journey. So that is the reason why a combination of these exercises would help a lot to see improvement in your symptoms.
Absolutely. And unfortunately, Tanvi, we run out of time to talk about mental health, and I think that's a completely different topic that
Different
we
topic.
about soon. But I think what I summarized from today's session is there is no one magic pill to cure PCOS. I think it is a combination of several lifestyle changes that you need to make consistently. I think consistency is very important to see the kind of
Yes.
change. For example, even for just skin and facial hair, you mentioned that it can take up to 12 to 15 months. And for those of you who are struggling with PCOS and irregular periods, I think it's very important to know that it is possible to get regular periods. I mean, we have a certified expert here sharing that. So please don't lose hope. And I think instead of working with, let's say, a doormat on only your skin, or only, with a fitness trainer, only on your exercise routine, maybe it's a good approach to work with a holistic partner who can help you across the board on different aspects of the lifestyle changes that you need to make. And that is what Veera does. And I think Veera is a great community of women who are offering the support that PCOS women struggling with PCOS require. So I think you guys are doing a great job, Tanvi. And thank you so much for joining us this evening. And I know we had a couple of extra questions, so thanks so much for taking those.
No problem. Thank you so much for giving this opportunity to me. And, it's always a pleasure to talk about, how we can manage PCOS, because, there's so many myths, so much information around, and it just confuses our audience at times, right? Because they just don't know where to, what to do, what would be the right approach. Even at Veera, when, patients have come up, they tried so many things, because they just want to find a solution, right? Because they just want to know what exactly is happening. So they have tried there's so many patients who have tried multiple things, but it just didn't work out, and they've given up. But then they come to Veera and they find hope, because it's all about holistic approach. It's all about how you're treating your body, and what you're eating, and how you're managing your lifestyle. Because when it comes to PCOS, there is no like a treatment at such where you take a medication and you get cured, right? So it's just about how holistically you're managing it. So when people come to Veera, because we are working on the 5 pillars, where exercise, diet, sleep, stress management, and then to be more consistent, because consistency is the key, as you rightly said. So when we're working on these 5 pillars, definitely women have seen tremendous results. They've seen so many improvements in the symptoms, because that's how it works. It's all science based, evidence based. We just have to, keep working around that and make sure that, we are feeling better, and this is possible.
Wonderful. Thank you so much, Tanvi. You have a great rest of the Sunday and hopefully we chat soon. All right.
No problem. Thank you so much. Bye. Have a good day ahead. See you soon.
Bye.
Bye.